This is another video from Stomatotech. We are going to discuss today the difference between the surgical guide with the telescopic tubes and the regular surgical guides. The advantage of the telescopic tube is for stabilizing the guide on the soft tissue. This is very important in case when we don't have teeth, in case of complete cases. We have here two guides that I prepared for the demonstration, and also a model with a simulated silicone soft tissue. What I'm going to do, I'm going to place first the regular surgical guide and to see how stable it is on the model. In order to demonstrate the stability, I'm going to use the SGLA and the reflector, which will be screened with a laser. So I'm going to alternate pressure from side to side in these 2 points, and later I'm going to make the same thing with the guide with telescopic tubes. So you can see how the laser moves, or basically the reflector moves, and the laser is not screened anymore when I press from side to side. Now let's try the same thing with the telescopic tubes. First I place the guide, and I already feel that these tubes are staying on the bone, or in our case on the simulated bone, which is the model. Okay, now I'm going to screen the laser on my reflector, and I'm going to press alternately on the guide, and you see that I press very hard and nothing moves. This is very important for the first stage of stabilizing the guide. Even though we have lateral stabilization in regular guides, but the initial positioning of the guide is very crucial. I want to show you closely how that sleeve works. You see it has an inner stainless steel tube which is moving inside a clamp, and we can place it on the level of the bone, and we can lock it, and then it will be absolutely locked, and it won't be moving, and it will stabilize the surgical guide. These sleeves, they come in 2 lengths, 8mm and 6mm, and you can purchase them directly on our website stomatotech.com. To conclude, I know that most of the cases are 1 or 2 implants, maybe 90%, but these 10% of the cases with complete edentulous patients maybe they have much greater importance for stabilization and for guided surgery, and that's why I strongly recommend to work with a guide that has good stability and can deliver very good results in terms of precision.